Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm absolutely delighted to have as my guest Dr. Neal Barnard. Neal is a medical physician that is board certified in psychiatry and neurology. He's a fellow of the American College of Cardiology. He's a prolific writer, author. He is the founder and president of really one of the most iconic plant-exclusive organizations, the Physicians Committee for Responsible Medicine. Neal has written many articles associated with the plant-based benefits of really reversing major diseases like diabetes, preventing Alzheimer's. And these articles have been published in a number of peer-reviewed journals, including Journal of the American Medical Association, Neurobiology and Aging, American Journal of Clinical Nutrition. And he's also a prolific author of a whole number of books. I go back originally to The Power of Your Plate way back in the day, but also a series of others like Food for Life, Breaking Food Seduction, Dr. Barnard's Program for Reversing Diabetes, 21-Day Weight Loss Kickstart, and of course, a more current book, Your Body in Balance, The New Science of Food, Hormones, and Health. And Dr. Barnard, welcome so much. Thank you for being here, really. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Well, thank you, Frank. It's great to see you again. Great to be with you today.
Yes, we go back knowing each other quite a few decades. I want to start because when I was doing a little research for this, I'm going to take you back to a place that, of course, is interesting to me. And to prepare for this, I watched your music video with Carbon Works. I just wanted to tell you that, and I thought it was fantastic. I love that kind of eclectic fusion of classical and rock. It was really pretty amazing. I had heard that you were quite an accomplished musician, so I really thoroughly enjoyed seeing that. So I don't know if you still play or if you're still involved in any of that or not. I know how busy you are with everything else. Do you still perform and play?
Actually, our the latest Carbon Works album just came out a couple of months ago. So there's all kinds of new stuff coming out all the time. So
I love it.
Anyway, thank you for asking about that.
No, it was fantastic. I'm a musician myself, so when I saw that that's what you did and what you have done, I was really turned on to that. And so I went on Apple Music and checked it out, and it was fantastic. The people you were playing with too were really quite accomplished, good musicians too. It was lovely. Neal, I know that I know you go back to starting PCRM way back, almost 40 years now, which is pretty remarkable. And I got to ask you, with all the things that change, I mean, this is even before, Al Gore discovered the internet. It goes back before that. So when I look at that and all those decades, I got to ask you, it must be really satisfying to see the evolution and progression of what you've accomplished by setting that in motion. And, with all the contingencies of change that go on and all the upheavals that go on, how do you account for the incredible ongoing success of that organization? How do you resonate with that?
Well, first of all, thank you for saying that. Yeah, the Physicians Committee for Responsible Medicine got started back in 1985, and a lot has happened during that time. But Frank, I have to be honest with you that we are always looking forward. So I'm always looking at the things that we have yet to accomplish. The fact of the matter is, Americans eat 1 million animals every hour. We have heart attacks and cancer and diabetes, and these are the things that you have been tackling over the years, and very successly. And these are the things that we've been working on. So our work is not done by any stretch of the imagination.
Now, you grew up in North Dakota, in Fargo. I saw that in terms of your early life. But it looked to me as I read your bio that you didn't get really involved in the whole vegan or the consciousness of vegan living until well into med school or your residency. Is that true? Or were there aha moments and things before that triggered that evolution?
Well, in Fargo, I grew up in the middle of cattle country. And my grandpa and uncles and cousins and my father were all in the cattle business. But I'm happy to say my father didn't like the cattle business, and he left it and he went to medical school. And he spent his life as the diabetes expert for Fargo. So that was really a bit of another world for me. And the thing that kind of started pushing me in a different direction was the year before I went to medical school, I had a job in a hospital in Minneapolis where I was the morgue attendant. So if somebody died in the hospital, my job was to help the pathologists who would come in and do autopsies. So I would get the body ready, and I will never forget, one day a man had died in the hospital of a massive heart attack, probably from eating hospital food, but that's another story. So anyhow, the pathologist pulled a big chunk of ribs off the chest, which you don't do with great delicacy, set the ribs on the table, and then proceeded to give me basically an anatomy lecture. He said, I want to show you what atherosclerosis looks like. And so he sliced open one of the coronary arteries on the heart. And he said, they're called coronary because they crown the heart. And so I looked inside, and it was filled with atherosclerotic plaque. And anyway, at the end of the examination, he wrote up all of his findings and said, systemic atherosclerosis, da-da-da. He left. So I had to put all the organs back in the body cavity, and took the ribs and put them back in the chest and sewed up the skin. And then I went up to the cafeteria. It had been a long exam. And I went into the cafeteria and said, you got anything left to eat? And what they had was a plate of ribs. And I looked at it, and it looked just like the body, and it smelled just like the body. And I didn't become a vegetarian on the spot, but I knew I was not going to eat that. And then when I got into medical school, I started to learn more and think more about these connections between what we eat and what happens to our health.
And that was really when you were in med school, really at the very early stages of what eventually became lifestyle medicine. It really wasn't happening like it is now, of course, the explosion. And we'll go into that because, as you know, even to this day, with all the information and research that's out there, the actual practice of medicine, aside from the benefits of emergency care and things that are really yeoman efforts to save people's lives, physicians, for the most part, are still trained to just be disease managers, meaning that they're not really providing really true health care, or this idea of the combination of prevention and reversal. And you've dedicated so much of your life and the research and through your organization to addressing this idea of reversibility, which is such a powerful idea, because for many people, they have a sense that if you do some of these positive lifestyle things, yeah, maybe you can prevent some things, but surely if you have the pathology, you're kind of stuck with that. And so when we, in all of our work, have shown this remarkable reversibility, that's really changed the whole texture of how healthcare should really be delivered. Now, I know you've done a lot of research through your organization and in your own writing with one of the real classic complications of chronic disease, which of course is really adult onset diabetes. So I'd love to get into your research, your take on that very real problem. If I didn't even know that your father, that was his practice too. And I'm assuming when he practiced, he did it very conventionally with just medication and typical medical care, but you've revealed so many other things. So let's talk about that research and this very profound problem that we know is so dramatically fixed by eating plant exclusive. Let's talk about that.
When my father was in practice, he would get home at 6 or 6:30 every day, and he'd set down his bag and slump into a chair. And I never, ever heard him say that anybody with diabetes ever was able to make the disease go away or even really improve very much. The whole goal at the time was to slow down the complications, because the life expectancy for a person with type 2 diabetes at that point was 10 to 15 years shorter than everybody else. And to tell you the truth, those figures apply to many people still today. So their whole goal was just to try to slow down the complications. But in 2003, NIH gave us a grant to try to find a better approach, which was focusing really on the cause. And it was focusing on diet, but in a very different way from what people were doing at the time. At that time, the approach was, well, you're overweight, you need to lose weight, so cut calories. And carbohydrate puts sugar into your blood, so don't eat too much carbohydrate. and that kind of thing. And that was our control group. And our experimental group was no limit on how much you eat, no limit on carbohydrate, no limit on portions, but we're going to take all the animal products out of your diet. So this is a vegan diet. And we're going to keep oils really, really low choices. So it won't be white bread. It would be whole grain breads and whole beans and vegetables and fruits and all the wonderful foods they turn into. And I will never forget, we had one of the first participants who came into the study was 35. He had diabetes for 4 years. And over the course of this study, he was telling me about his family, his maternal grandmother, his grandfather had diabetes, terrible complications. His father was dead at age 30. He was telling me, I'm going to end up losing a leg. I'm going to go blind if I don't get this under control. Anyway, he began the plant-based diet. And as time went on, his A1C, which was 9.5 to start, which is high, it's not good. It started coming down and coming down and coming down. He lost 60 pounds over about a year's time. And his outside doctor said, you got to stop all your medicines now. You don't need diabetes medicines anymore. You're getting better and better. And his A1C dropped to 5.3, which is a totally normal A1C. I mean, in other words, his blood sugar control had returned to normal. And I got to tell you, I was taught, and I know you were taught in your training, that diabetes was a one-way street. You got it, you'll never get rid of it. And here was a man who could go into any clinic in the world and they wouldn't diagnose him as having diabetes. And so then at the end of the day, the control group did well with their control diet, but the people on the plant-based diet had a drop of A1C of 3 times more. They're reducing their medications. And so now when we use this we're doing a large research study now, we've been doing studies all along, people come in, instead of feeling like I'm just a recipient of medical care, I just got to take your prescription and go to the pharmacy counter and inject myself. Sometimes you do need medicines, but for the most part, people feel, I've got some power now. I understand what causes insulin resistance that's leading to my diabetes. I can see how to change my diet to make that improve and maybe even go away. And they feel terrific. And the doctors that we work with, they feel great too, because they're not in an assembly line anymore. They're able to really help people. They're tackling the cause. I know you've seen this in the tremendous work that you have done, Frank, where medical professionals come in and they learn a new way of thinking about this, and it's just the most wonderful thing for people to see that power and to be able to reverse.
Well, it's such a mind-blowing thing, because if you think about it, and I always felt this was a sad shortcoming, because look, we talk about political and economic medicine, but when you're looking at doctors day to day, they're trying to get people well. They would love to get people well. They want to help people. Many times they've gone into the profession to be able to help people. And one of the sad consequences is they've never really, in many ways, seen anybody get well, because they've always been told that they can't. So all you need to do is manage what they have. So when they encounter a situation like that, it's like an unbelievable breath of fresh air. It's like the heavens open up. Oh my God, I actually can help people get well. Neal, when you touched on that, let's touch on something, because whenever we talk about this, it still blows people's minds, because they're so stuck with the notion of carbohydrate relationship, even plant carbs, to diabetic outcome. And we know that it's really high saturated fat and so on that really interferes with insulin sensitivity. Talk a little bit about that relationship of diet, high fat from animal and refined food sources, and the impact on insulin resistance and the consequences of that. I think it's always eye-opening and important for people to hear that.
Yeah, this is something that was discovered decades ago, and I really want to give the credit to our friends at Yale University in the Department of Endocrinology, where they were doing studies in human beings and figuring out what caused insulin resistance. And it really starts with something you eat. You eat a pork chop, or you eat a chicken wing, or some battered shrimp and the grease is dripping out of it. And as it slides on into your stomach and goes through your intestinal tract, the fat particles come out of that food. They get into the bloodstream and they pass into your muscle cells. And the reason that matters is that muscles normally are powered by glucose, sugar. And that glucose has to try to get into that muscle cell. But the muscle cell is filling up with fat from our chicken wings and our pepperoni pizza and everything. And as that cell fills up with microscopic fat particles, the insulin, which comes from the blood through the bloodstream to the surface of that cell, it's like a key trying to open that membrane up. It doesn't work. It just can't work when the cell has all that fat inside. So at that point, you eat anything. You can eat a piece of toast or an apple or whatever, your blood sugar goes up. And so people mistakenly thought that the problem was the starch or the sugary thing that they ate. That wasn't the problem. Normally, you can eat those foods and the sugar that is released gets into your cells really easily. So the approach of our diet, no animal products, keep oils low. What does that do? That causes the fat in the cells to dissipate. And as it goes away, the insulin sensitivity returns, and that's why you can reverse diabetes.
Yeah, and then when we see people come into, I've run, and you know this, I've run retreat centers for many, many years. We'd have people come in and eat nothing but plant carbs and have blood glucose levels drop hundreds of points in a week or two. I mean, and we see it all the time. It's not like it's an isolated occurrence. I'm here with Dr. Neal Barnard, the president of the Physicians Committee for Responsible Medicine. We're going to take just a few minutes to hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science podcast. I'm your host, Dr. Frank Sabatino. Are you ready to revolutionize your health? Then you're ready for the 2024 National Health Association Conference taking place in June of 2024. Join us for inspiring talks by experts like Drs. Dean and Aisha Shirzai, Dr. Neal Barnard, Dr. Ron Weiss, and Dr. Lori Marbus, in addition to Drs. Goldhammer, Dr. Esser, Dr. Fitzgerald, and yours truly, Dr. Frank Sabatino, along with leading SOS-free chefs Kathy Fisher, Brittany Giroudi, and Dylan Holmes. Register now at healthscience.org/NHA conference and enjoy early bird savings until December 31st of 2023. This conference will transform your health journey. Secure your spot today. And remember, your feedback matters. Please take a moment to leave a rating and a review wherever you're listening to the NHA Health Science podcast. Also, be sure to visit the NHA website at healthscience.org. That's healthscience.org to get lots of great recipes, articles, newsletter archives, and become a member of the NHA. I'm Dr. Frank Sabatino, your host, and now back to the show. Welcome back to the Health Science Podcast. I'm your host, Dr. Frank Sabatino, and I'm here with Dr. Neal Barnard, who is the president of the Physicians Committee for Responsible Medicine, and we are engaged in a very important discussion of diabetes and its ability to be reversed by eating plant exclusive and working with the lifestyle, the pillars of lifestyle that we talk about, also including exercise. I think sometimes people don't realize how powerful activity is for improving insulin attachment and insulin function. So that combination of food and physical movement are just such powerful interventions in dealing with this profound problem that affects millions and millions of people.
Yeah, exercise is a great thing, and I strongly promote it. Even so, I want to reassure people, let's say exercise isn't in the cards for you. Maybe a person is massively overweight, or they've had an amputation or whatever, and so their ability to exercise is limited. We still improve dramatically. So add the exercise if you can, and that will help you. But if you can't, you still do well.
And let's address this. When insulin becomes resistant, the body starts to believe it's not making enough. So you have this overproduction of insulin, and that hyperinsulinemia. Insulin almost works like a growth factor, triggering so many other factors, potential cancer growth, heart damage, and so on. Just address that a little bit, because people I don't think, see the corollary to, all right, so insulin's not working as well. What's really the corollary to that? Just touch on that briefly, because I think it's important for them to know.
Everything goes bad, unfortunately. And when a person has diabetes, it's not a high blood sugar or a low blood sugar that kills them. It's cardiovascular disease. And what that really means is that the arteries themselves are attacked. And that's everywhere they are. including the arteries to the heart, the arteries to the brain, the arteries to the kidneys, so the kidneys can give out. And then as the brain is affected, we see people who've got diabetes have a much higher risk of developing Alzheimer's disease compared with other people. And as we saw during the advent of the COVID pandemic, the people who were dying as opposed to surviving were very often people with diabetes that was not in good control. Now, what we discovered is that when they got their diabetes under control, the virus wasn't so terrible for them. So what this is really implying is that this disease affects your immune system. It affects really all aspects of your life.
And that was consistent with those kind of global studies that showed people eating plant exclusive or mostly plants in that lowest level of severity in response to that infection too, which of course the media never really shared with anyone, which was really quite present. And it was sad that it wasn't talked about that way so that people could understand the power of eating whole plant nutrition in relationship to the immune system, as you just brought up.
Well, this is so important, and it's important not just for COVID, but it's important for all infectious diseases, really. But with regard to COVID, there were two huge studies that showed that people who follow more plant-based diets do much better. When COVID arrived, they were more likely to survive than the people who were on unhealthy diets. They were much less likely to have severe illness. And the reverse was true for people who were doing high-protein, ketogenic, low-carb diets. When they got COVID, it was a disaster.
It was slam banged. I know.
Yeah,
Amazing.
exactly.
Neal, let's shift gears just a little bit and talk about something else that you have really covered a lot in your more recent book on food related to hormones and health. I've spent so much of my life doing research in endocrinology and hormone relationships. And this is an area that I think is kind of a bit of a black box sometimes for people, not really realizing the profound relationship between what we eat and the impact on hormonal balance and endocrine function. So let's talk about that, and maybe with the model of using even, let's say, female reproductive hormones, estrogen and so on and so forth. Why don't we get involved in that discussion? Because we have a lot of women watching, and I think it would be of great interest to them to really feel and understand that importance.
Yeah, I have to say I got into this by accident. I was sitting at my desk and the phone rang, and it was a young woman who had menstrual cramps. Now, many women have cramps, but for maybe 1 in 10, it's off the scale type.
Right.
Can't get to work today type cramps. And that was her situation. And she had a business meeting out of town. She needed to get on the plane. And all she wanted was some painkillers that would get her to the airport. And I said, let me see if I can help you. Let me give you 2 days worth of painkillers. But she was talking about her symptoms. I started to think, this is going to happen again next month and the month after that. So what's driving this? And long story short, I happened to remember that at Tufts University, and actually a number of other universities as well, researchers have been trying to tackle breast cancer. Breast cancer is driven by hormones as well for many women. And researchers at Tufts noticed that if a woman reduces the fat content of her diet, her estradiol level will go down. Estradiol is the main female hormone for women during their reproductive years. And if they don't just reduce the fat, but increase fiber, that's plant roughage, her estradiol level will go down too. So I thought, okay, what are menstrual cramps? What that really means is either the uterine lining, the endometrium, is getting too much estrogen. It's bathing in estrogen every month. And if there's too much of that, it's thickening up too much. And when it disintegrates at the end of the month, it releases prostaglandins, which cause cramps. So that's a good reason to get rid of the excess estrogen. Or the other possibility is endometriosis, where you've got endometrial cells, but they're not lining the uterus, they're outside, and they're implanting on the ovaries and the fallopian tubes and all around. So in any case, if we increase fiber, reduce fat, or both, that ought to bring down estrogen and stop fueling these conditions. So I said to the woman, let me give you a prescription for a couple of days of painkillers, but would you like to do an experiment? She said, anything. I said, how about this? For the next 4 weeks, no animal products. Let's keep oils really, really low, not for cholesterol or for diabetes, but to get her estrogen levels down. She called me back a month later, zero pain. A month after that, zero pain. And as time went on, she was fine unless she would loosen up the diet. So I ended up doing a randomized trial with the Department of Obstetrics and Gynecology at Georgetown University. And what we discovered is that this works. Different women get different effects, but by and large, it shortens the amount of pain they have. It reduces the severity of the pain, sometimes makes it go away. And it reduces the PMS symptoms like bloating and water retention and moodiness. So it's a terrific thing to hand a woman some power that she didn't know she had over her life and how her body works.
You know, when you look at some of the primate research, because I used to be near Yerkes in Atlanta, they make the point that when you look at the closest primates to us, whether it's bonobos or chimps or whatever, their menstrual cycles are just almost a clear fluid. They don't have the clotting, the bleeding, the incredible pathology. So you could make the case that some of what women are really suffering with is not necessarily physiological. It's very pathological, as you point out, and that by making these kinds of changes and getting back to a more natural diet for our natural human diet, you can really quiet some of those symptoms and pains as you described. Let's take it the next step then. Let's go from the normal menstrual years. Let's go into the areas toward perimenopause and menopause, and let's address that a little bit, because that's when we see so much suffering that can go on for so many women through those periods. Let's address that a little bit in relationship to what we're talking about.
You bet. And before we leave the earlier menstrual years, let me mention that when we're doing any kind of study, weight loss or whatever, when women do this kind of diet, if they've got heavy flow and cramping and clotting and things like that, they often notice big changes very, very soon. So I'd encourage anybody to give it a try and just see. So with regard to menopause, back in the 1970s and 80s in Japan, when women reached menopause, they really didn't have much in the way of symptoms. Hot flashes, maybe 15% of women had them. They were mild. They didn't even have a word for them. And at that time, what was the diet? Huge amounts of rice, fair amount of vegetables, some fish, but it wasn't a huge amount of fish, and it wasn't a big part of it. And dairy was mostly gone. It just wasn't. It is not a Japanese tradition. This is not a Velveeta diet. But starting in the 80s and certainly in the 90s, fast food chains came into Tokyo and Osaka and everywhere. And what you started to see is that not only did breast cancer rates go up and obesity and diabetes and everything, but hot flashes went up from about 15% to over 40% of women. And so we thought, all right, two things. Maybe soybeans are protecting them or were protecting them, because soy has isoflavones that help with menstrual function in many ways. They reduce cancer risk. But apart from that, just something about being on a more plant-based diet should be part of the solution. Except, Frank, the other clue came to us, though, that if you look at other parts of the world, you see something very similar. In the Yucatan Peninsula of Mexico, up near Cancun, researchers have interviewed Mayan women and found virtually no menopausal symptoms either. Now, they're not eating rice. They have a grain. Their grain is corn. And they're not eating soybeans. Their bean is the black bean. That's the favorite bean in the Yucatan Peninsula. And they have lots of vegetables that a gringo like me never heard of, like la chaya and others.
Right.
And these keep them well. So anyway, I wrote about this in my book, the power, Your Body in Balance. And the whole point of Your Body in Balance was to talk about how different hormones could be controlled by food. So anyway, Frank, I got to tell you, my phone rang one day. It was a woman who said, I read your book and I did what you said, and my hot flashes were gone in 5 days. And I said, wait, stop it. That's pretty fast. And what did I say? What did you interpret from my book? She said, well, you said throw out the animal products, keep oils really low. You said soybeans ought to help. I said, well, wait, I didn't exactly say how much in the way of soybeans you should have. What did you do? She said, okay, I had 0 animal products. I stopped adding oils to things. I cooked without oil, and I made a half a cup of cooked soybeans every day. And I wrote all this down. And after she hung up, I ran into the office of Dr. Hanna Kaliova, our research director, and I said, I've got our next study. I want to bring in women, give them Betty's diet, and see how many women this helps. And to make a long story short, we recruited 84 people, and their hot flashes, their moderate to severe hot flashes, dropped almost 90% in 12 weeks, which is what you accomplish with hormone replacement therapy, but you do this without a prescription, without risk.
Did you feel
And
it was the
we figured out-
estrogen? Did you feel it was the estrogen like isoflavones that were contributing to that? What did you feel was that?
Well, Frank, I got to tell you, I want to separate from what we know from what we're guessing about.
Yes.
And what we know is that it works. It works really well. And it also causes weight loss. The average woman lost 8 pounds in 12 weeks without calorie counting. And so it worked great. And their hot flashes really just went down dramatically. However, we can't, for some reason, all 3 of these pieces of the diet seem to matter. If a woman really wasn't vegan,
Right.
it doesn't, she can have soybeans. It doesn't seem to knock it out. If let's say she's vegan and she's having her soybeans, but there's a lot of grease in the diet, that doesn't seem to work so hot either. Or let's say she's following a plant-based diet, but the soy isn't part of it. That doesn't work as well. So the way it looks from here is that for some reason, you put these 3 things together and the hot flashes for many women just disappear. And it starts with, at night, you're waking up every 2 hours, and sweating and so forth, feeling miserable. And that just kind of goes away. And it's a really great thing for the participants.
Did you see results with some of the mood changes and other things that happened during that time? Or was it just really solely related to the temperature changes?
That was the main
That's what
target.
you
However, we use a questionnaire called the Men-Qual questionnaire, where we look first at what we call vasomotor symptoms, that's hot flashes. Then we look at psychosocial symptoms. How do you feel? Are you depressed? Are you nervous? That kind of thing. That improved. Then we look at physical symptoms. Are you headachy, for example, or other things? That improved as well. And the 4th thing we look at is sexual symptoms. And many women have major sexual changes at menopause, and those improved as well. Now, don't get me wrong. I don't imagine that a low-fat vegan diet with added soybeans is going to prolong sexual functioning forever. But for many of these women who right now, they go to the doctor and they're given a prescription for systemic hormone replacement therapy,
Right.
Along with an apology about the fact that it might increase the risk of many, many health issues. They don't really need to do that. They can use this diet to take care of those things if they want to supplement with a little bit of local estrogen or something like that in a cream, so that their sexual functioning is.
So you actually saw benefits on the vaginal epithelium, is what you're saying. You saw improvement of that. It wasn't as brittle. It wasn't as fragile. That was a byproduct of the intervention that you measured.
That's right. But what I am saying is that I suspect that will not last forever. I suspect that those women may wish to use some local medication. But what we did is we knocked out their hot flashes, so they could get through a board of directors meeting without breaking out into a sweat. They could sleep all night, and it seems that the effects just continue. Now, my best guess is that people don't have to continue with a half a cup of soybeans every day. Eventually, they can probably taper off and see if they don't need it anymore. But for the women in the study, it was just a life-changing experience.
Neal, there used to be an older hypothesis, and let me, based on what you've looked at, let me get your idea or your feeling about if there's any validity to it. It was the idea that the symptoms or the changes in perimenopause, before they actually settled into a more stable state of menopause, had to do with the premenopausal extent or level of estrogen that was ratcheted up by processed foods, animal foods. And it wasn't just the drop in estrogen, but the extent of the drop that played a role in triggering some of these symptoms. And women that started with lower levels, let's say they were vegan for much longer periods of their lives earlier, the drop would be not as precipitous and the symptoms would not be quite as profound. Does that hypothesis still hold, do you believe, or not?
I think it's a very reasonable hypothesis, and I would add one other piece to it. Back in Japan in 1960, 1970, it was not a dairy country at all. And dairy products are one of the foods that have estrogens in them. So if you live in Omaha or Fargo or Minneapolis, and you're eating, the typical American eats about 70,000 calories worth of cheese every year, you're dosing yourself with estrogen day after day after day after day. And the hypothesis that you've articulated suggests your body is trying to sort of accommodate to that.
Let me take it one step further, because when I was doing some research, there was this notion that estrogen provides a level of neuroprotection they actually can play a role in cognitive decline. And let me just lay this out to you, because apparently when we look at full-blown Alzheimer's disease, 2 out of 3 people with Alzheimer's are women. And the idea suggested that, is there some relationship between the change and drop in estrogen and the loss of neuroprotection at the level of the brain? Have you seen any other research that would provide, would support that, or would challenge that, or question that?
I think it's an area that we should certainly be looking into, but I don't know the answer to it, and I think we're gonna have to wait and see.
Yeah, there are people that I know are focusing on that a lot, so it'll be interesting to see where that transpires.
Yes.
You have spent a lot of time in doing work with, obesity and weight loss, and we've kind of touched on that a little bit in our discussion here. We generally present the idea of the plant exclusive way of eating as providing something that is low calorie density, low in fat, providing the idea that we can eat abundantly, eating, it's not about eating less, it's about eating well, and weight loss is a byproduct of that. Is that general tone the way you go, or are there specific foods that you feel need to be addressed in more effective weight change across time?
Well, yeah, it really is true. When a person chucks out the Velveeta, and if they're not eating dairy products, and they're not eating meat, they're not eating eggs, and if they really reduce all the oils that they were frying their onion rings, that kind of thing, they've done a great thing. They've removed all the really calorie-dense foods. And so what you're left with are foods that are still voluminous. They're high in fiber and high in healthy complex carbohydrates, so they're filling, but there's not a lot of calories. And so a person feels satisfied, but they look at the scale and it's amazing, they're losing weight. So that's really the key. However, we've gotten a little bit more refined over time. What we've discovered is that when a person eats high fiber foods, the fiber is going down the digestive tract, and it's just plant roughage. It actually traps some of the calories in the foods they've eaten. A little bit of fat here, a little bit of protein there, something, and it actually carries it out with the wastes. And so your average person on a high fiber diet is actually excreting, they're flushing down the toilet some of the calories that otherwise they would absorb. And it adds up day after day. And when we measure people's metabolism, their calorie burn, that's augmented too. So yes, the answer to your question is yes, a big chunk of the weight loss is because you're just not eating a huge number of calories, because these foods they're just not calorie dense. But your body is doing 2 tricky things. It's trapping some of those calories that you do eat and flushing them away, and it's boosting your metabolism for 3, 4, 5 hours after the meal. So you're actually burning off more calories,
Right.
and that's what really helps you conquer the weight
So,
issues.
yeah, so it's not about specific foods. It's about eating a diversity of plant foods that provide this abundance of fiber. And we didn't even touch on it, but of course, that fiber is used by this remarkable teeming world within us, the microbiome, microbiota, to actually feed them the fiber that they need to ferment and feed themselves. And apparently, there's some satiety signals that are provided in that feedback from that
Yes.
healthy population of organisms to help us control some of that eating and digestive function.
Yes, but it actually is about. I should say that there are some specific foods that I do think help. A general high fiber diet is good. However, our good friends at Harvard University did an interesting study where they looked at people who over time would increase or decrease different foods in their diet, as people just might normally do. And they discovered that certain foods, if you tended to be adding them more to your diet, you would tend to lose more weight. And this was not just in 20 or 30 or 40 people, it was in tens of thousands of people. And so they were able to crunch the numbers. And it was really amazing. People who would eat more citrus fruits, we didn't know why, but they tended to lose more weight. Melon, people who ate more melon, they would tend to lose weight. Soy products, for some reason, people would tend to lose more weight with them, which was so surprised because soy has a fair number of calories in it. But the number one, the granddaddy of all, the one food that if you ate a little bit more of it, which caused a bigger weight loss, was actually the berries, blueberries, strawberries, raspberries. And we thought, okay, wait a minute. Could this be that they're not just high in fiber? And, there's no grease in a berry. You don't your hands don't get all greasy eating it.
Right.
But could it be that there's something else? And that something else is what makes the blueberry blue. They're called anthocyanins, as you know. And anthocyanins, that's nature's painting box. The leaves in the fall are painted by anthocyanins of a different color.
Right.
But blueberries, grapes have anthocyanins. So researchers in the United Kingdom did an amazing study. They rounded up identical twins, young women, identical twins, and they tracked what they all ate. And then they did DEXA scans where you're scanning the body, you're quantifying body fat. In every pair, one pair was eating a little bit more anthocyanins, the other pair eating a little bit less, and their weight change went right along with it. So what we're thinking is there is something magical about these antioxidants that are built in and that are colorful and that we see in foods. So that kind of tips the scale even a little bit more.
So it had an improved metabolic effect. I mean, that's what you saw with the intake of berries.
Right. Exactly.
Intriguing. That's really
exactly. And I mean, you can't.
Well, the problem is you got anthocyanins, but you've got so many thousands of micronutrients too. It's hard to tease out what all that could actually be. Though you feel that that one component was a very profound part of the results that they saw. But when you think about a whole food like a berry, there's so many nutrients that are involved. It's going to be difficult to tease that. At least we know empirically adding those to the program is going to give you a better benefit, which is a major finding in itself. So that's amazing.
Yeah, exactly. So it's dessert time. And on the one hand, you could pour some, frozen dairy or something like that into a plate, and you don't get any fiber and you don't get any anthocyanins, and you're going to gain some weight. On the other hand, let's say I slice up a mango, and I slice up a banana and mix it together, and I sprinkle a whole bunch of organic blueberries over the top. And what you discover is that the sweet tastes of them just melt together in this beautiful way. And your body says, I know these foods. Thank you for thinking of me. And these foods really sustain health. And what you said is exactly right. You don't just get anthocyanins or just fiber or just healthy carbohydrates. You get all these things in these foods, and you don't get them in the foods that I grew up with, but
Right.
You can take advantage of them now.
Yeah. I'm here with Dr. Neal Barnard. Neal, where can people find you? What's the best location for them to learn more about, what you're doing, the books that you have, all of that? Where should they go?
Oh, well, yeah, sure. Thank you. PCRM, that's the Physicians Committee for Responsible Medicine, pcrm.org. And I hope people will have a look. And you asked about music, so let me share. People should go on YouTube. And when you go there, look for the band Carbon Works, as in we are made of carbon. These are our works. And you'll see a couple of dozen of our music videos. I hope people enjoy them.
And I can vouch for the fact that you want to do that. The music was fantastic. Neal, let me say something. The NHA has gotten to the point where they've set the bar a little bit higher, where it's not only a vegan approach, it's now SOS free, meaning they're advocating, not adding salt, oil, and sugar. And, we know about oil, we know about sugar. The salt situation becomes a little controversial. Let me lay this out. One of the benefits, apparently, when you look at research is that, you've got this gel-like lining that protects the endothelial lining of blood vessels, especially little capillary beds called the glycocalyx. And apparently salt content, as it goes up, and of course, it's profound in a lot of processed foods compared to the actual amount that we need, that it could have damaging effects with inflammation and damage to those linings. Do you buy into that? Do you feel supported in the literature with that comment about the impact of excess sodium on glycocalyx and endothelial health?
Well, I think you're really onto something. And I think, frankly, this is the frontier we need to be at, because let's face it, people are adding salt to everything, huge amounts. And if you didn't add any, the manufacturer did. You could get a can of green beans, and I tell you, when those green beans came out of the garden, there was virtually no sodium in them. I mean, there's just a little bit, but once you crack open the can, all the sodium they added to the factory is there. We've known for a long time it spells problems for the blood pressure. And you mentioned, the other issues that are perhaps more profound. And then the big issue is that people's tastes for salt have gotten set. And so then when you're going to bring them down, they feel like food has no flavor at all. No, they'll get over that. Your tastes will adapt really surprisingly quickly. But that's, I think, exactly where the discussion has to be.
Yeah, we see that all the time, especially those of us that are even doing fasting and those kinds of changes. The increase in taste sensitivity is so profound. People will come out of a fasting state, have a piece of plain romaine lettuce, and they'll be like, this lettuce.
Yes.
They're tasting things that they never even knew existed in that food. So we need to change that, because that little bit of pleasure trap that's driven by the incredible additives that are in that food processing industry are really feeding that addictive process and, driving business, but hurting people long term in their insensitivity to taste. Let's shift gears, because I want to touch on the fact that you've been a good friend, and you've been someone that has been connected with the National Health Association for many, many years. And we're all doing very similar work. You've been around a very long time. And I want to just emphasize that at the end of June in this next conference, you're going to be one of the featured and keynote speakers. What's one of the things about or anything about the organization that's been attractive to you? What turns you on about it?
Well, really two things, Frank. The first thing is that for me, this has been a learning experience and continues to be. Let's face it, there's a lot for us all to learn. And I have to say that that's what NHA continues to provide for all the people who come to the conference. And for me, I learned so much. But there's one other piece of it, that when I'm there, I know that I'm getting really the straight information from people who are working in the same direction to make health really something that's approachable and something everybody can take in the hand. I kind of feel like I'm home. So it's really both of those things. It's learning, but it's also the support.
And we know how important a sense of community is for long-term health too. And when you're in a room there with 400 people moving in that same direction and eating together and sharing that information together, there's something very empowering about having that community connection, in that sense, and sharing like-mindedness with all of those people. So it is a beautiful thing. And that's what's kept me connected to it for many, many decades too, very similarly.
Exactly. And I have to say, along the way, I've learned an awful lot from you, Frank, and I have you to thank.
That's likewise for me too, Neal. I really, before we wrap this up, as we wind this down, is there anything you'd like to leave the guests, the audience with? Any final messages or words you'd like to share with people?
I got two quick things. The first is we published a study in JAMA Network Open, which is the JAMA online version, where we wanted to see what happens to your food purchases. People think of a healthy diet as being really expensive. So what we did is we brought in 244 people. Half of them went on a healthy plant-based diet. The other half stayed on their same diet. And what we discovered was really something. The people who changed their diet did spend more on fruits and vegetables and beans and plant foods in general, but they spent less or none on meat, nothing on dairy, nothing on eggs. And so overall, their food purchases dropped by about 16%. So when you do the math, that works out to be about $500 a year in their pocket. So a healthy diet isn't expensive. It's the opposite. It's a money saver. And the last thing I would just say is that when people come in and they work with us in our clinics or in our research studies, what they very often say is, I thought this was going to be harder. This is easy.
Right.
And I say, well, why do you say it's easy? And it's because they did a diet before that told them they could only eat 800 calories a day, and they were hungry and they had to just tough it out. And we don't make them do that. Or they were on a diet that restricted carbohydrate, and they would have killed to have a potato or some rice or something. And or they're told they can't have fruit, and they feel like we're letting them eat the foods their body really wants. And so my point is, it's easy. You save some money. You can put that in your piggy bank, and you can save up for your next trip to Hawaii.
Well, I can't thank my special guest, Dr. Neal Barnard, enough today for sharing his time, his insight, his inspiration, his research, his work. And I urge you, please, anyone, follow Neal. The location where you can find them is in our show notes, pcrm.org. And you have a lot of tremendous information you can gather on your journey to health and well-being, following him and his organization. And I really want to thank the people out there today that joined us, because without you, we couldn't do what we do. And I want to really thank you for being part of this active and healthy community. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to seeing you at the next episode of the Health Science Podcast. You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.